Thank you. At this time, we'll call to order our May 20th board meeting of the Oakland Community Health Network. At this time, if you are able, please rise for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. This time we'll have the roll call of the board.
Mr. Young.
Here.
Mr. Furman.
Present.
Dr. Giles. Pastor Jones.
Here.
Dr. Guadalupe.
Here.
Ms. Woodruff.
Here.
Dr. Hans. Here. Ms. Newman.
Here.
Ms. Root. Here. Ms. May. Mr. Smith.
Here.
Mr. Cowan.
Here.
You have a quorum.
Thank you. At this time, we have the first opportunity for public comment, both for those online and in attendance here with us. You know what? I'm out of order, which is not unusual. No, we need approval of the board meeting agenda first.
So moved.
Support. Move and support. Any discussion? All those in favor say aye. Aye. All those opposed, the motion carries. Now we have the opportunity for public comment, whether online or here present with us. We ask that you please state your name, your address if you would like, and also if you would limit your comments to 3 minutes. So at this time, do we have anyone who is online?
If you are online and wish to speak
Yes.
for public comment, please raise your hand at this time. Joy, you can go ahead.
Thank you. Do I need to turn on my camera or will this be audio?
Whatever you prefer.
Thank you. My name is Joy Nagy Wilkins. I'm here about the poor decision and execution of the transition of financial management services. I'm the sibling and guardian of my sister and brother who received the support services provided through Oakland Community Health Network using arrangements that support self-determination. For their health and safety, my sister and brother require 24-hour, 7 days a week direct care support. And for clarification, I'm speaking about OCHN's takeover of the management of all financial management services, or otherwise known as the agency that handles payroll for employers and self-directed support or self-determination arrangements within the service provider network. OCHN recently took this role away from Easter Seals MORC and CLS. However, OCHN's takeover simply meant giving the responsibilities to GT Financial, one organization who is not equipped or prepared to handle this service. Our home has 2 CLS staff provider agencies who are both credentialed with OCHN, CLS, GT Financial, and the Arc of Oakland County as required. This FMS transition has been a nightmare for our family. I'm not here to complain about GT or the Arc. I'm here in support of them, as well as the staffing agencies who have not been compensated since the transition commenced on April 17th, 2025. If it weren't for our staff providers keeping us afloat, my sister and brother would not be cared for. Our 2 provider agencies are covering payroll for their employees, direct support professionals, who would otherwise quit and go find other paying jobs. As guardian, I should not have to worry every other week that my siblings' caregivers won't get paid and that my siblings' health and safety would be in jeopardy. I attended the sessions that OCHN hosted for families. We were told nothing will change. It'll be simple. Well, I know firsthand it has not been simple, and it certainly has not been smooth for the staff providers or GT. There have been rate discrepancies and authorization inconsistencies, Timesheets are not being submitted electronically. They're in a paper fax format. So we're experiencing data entry errors. Home help hours are having to be manually removed from the timesheets and the hours entered by hand. And the kicker for me was when I was told that as guardian, I need to sign off on all caregiver timesheets bi-weekly. Clearly, OCHN's attempt to save money by disrupting the financial system has not been prudent for anyone in the service flow. Please know that families have seen what you've done here, and we are not happy. Thank you.
All right, thank you for your comment. It's impossible for us to make any comments on individual situations, so someone, I think, Trish, our deputy, has been making notes, and someone will get back with you. Okay? Thank you.
Thank
Is
you.
there anyone else? Is there anyone else online?
Is there anyone else online? Please raise your hand at this time.
Okay, thank you. Is there anyone in the audience who wishes to address the board? There being no one, we'll close the first opportunity for public comment, and we will come back at the end of the meeting for a second additional opportunity. Tonight, we're very pleased to have our Stories That Inspire Hope with the Judson Center, and is Suzanne? Yeah, good. Or who? Okay. Okay. Wasn't sure who was coming up to do the introduction, but come on up. Yeah, you're switching up on me, right?
Mr. Cowan, we have one member that is going to be part of this group that is running about 5 minutes behind. She's en route. So just
Okay,
share her
we
story.
can hold off. Just let me know when you're ready to go, and we'll fill that in. Okay. So in the meantime, we'll proceed to the business portion of the agenda. The first item is reports, and one is the chair's report. Obviously, I, along with the finance chair and others, have been involved in the transition for our finance department and a new CFO, and continuing to work with the staff and others to make that as smooth as possible, and also to set some parameters for the needs that we have, in addition to the usual financial reporting that is being done. So given the situation financially with the continued underfunding of OCHN as well as other networks in the state, we thought this was a necessary and prudent move. So that transition occurred not too long ago, and we'll keep everyone apprised on that progress. At this time, with board approval items, we have the Crown Castle contract amendment. This was reviewed last month by the Finance Committee, or excuse me, not last month, but last week at the COW meeting by the Finance Committee, and was approved for presentation to the board. Is there any suggested action?
Move for approval.
Second.
A motion and support. Do you want to cover that at all, Mr. Young?
Sure. It's for fiber optic internet service for Troy and Pontiac locations. The not to exceed amount is $190,088. It has been a current provider, so it's a contract extension technically for fiscal 23 through 25, and then the ability for a second amendment of fiscal 25 through 27.
Right. I believe it was a question at the last meeting by
Did you get
Christina.
an
Did we
answer?
get an answer? Okay.
For sure. Okay.
Okay. All right. Just
Okay,
wanted to make
okay.
sure that, okay.
Yep. Good memory.
Is there any discussion on this item? There being none, a roll call vote, please.
Mm-hmm. Mr. Young,
Yes.
Mr. Furman,
Yes.
Dr. Giles,
Yes.
Pastor Jones,
Yes.
Dr. Guadalupe,
Yes.
Ms. Woodruff,
Yes.
Dr. Hans,
Yes.
Ms. Newman,
Yes.
Ms. Root,
Yes.
Mr. Smith, Mr. Cowan,
Yes.
motion carries.
Thank you.
Also, the member we were waiting for has arrived. So
Oh, okay, perfect timing. Okay, so now I will re-invite the team back up for introductions and presentation by the Judson Center.
Can you hear me? Everyone's making their way up. Okay.
Good evening. I'm Jillian Trumbull. I'm the director of the Provider Network here at OCHN. And one of the things that my team does is oversee our provider network. And one of those providers includes Judson Center. They provide services. They have several contracts actually with OCHN. One that provides services to youth with SED, another that provides vocational services, and then they're here tonight to talk about their autism autism center. So their ABA services for youth that qualify for the Medicaid autism benefit. So I'm very pleased to introduce Lenora Hardy Foster, who is the president and CEO, Sarah Cerise, who is the director of the Autism Connection Center, and a parent whose child receives services or has received services, Cassandra Fair. So I am going to quietly sit here while they do their presentation.
Thank you so much for that wonderful introduction. And I want to start first by thanking you all for giving Judson Center this opportunity and just to say good evening to everyone. Let me share a little bit with you about Judson Center. You know, we're really proud that we've been in business. We just celebrated 100 years. It's opened the doors back in 1924. You know, we had a mission back then that we wanted to be in business to make sure that every child was taken care of. So we started as an orphanage. And if you fast forward 100 years later and take a look at the work that we're doing, we're impacting the lives of so many children, adults, and families, you know, in Oakland County and other surrounding counties. And it's really great to know that, you know, we're still with Child and Family. You know, we're one of the foster care and adoption agencies here in the great state of Michigan. We have an integrated health program. We're really proud of that. It consists of behavioral health, primary health care, and substance use disorder. You know, it's sad to say even our children at times are experiencing problems with opioid and SUD, and so we're there to provide the services to them as well as adults. Disabilities, we've been in that line of business for many, many years. But autism, you know, we are proud to be one of the autism providers here in Michigan. You know, it is really sad when we take a look at where we are today and a lot of our children that are being diagnosed with autism. But one thing that we know through clinical treatment, how a child can still grow up and be able to live a life full of quality and do a lot of the things that you and I can do today. So we are proud of where we are and what we've been doing. And over those years, you can imagine 100 years ago, probably a small number of children we were serving. Today, we serve more than 13,000 children, adults, and families annually. And so we are proud of that. You know, and when I look at, you go back and take a look at how we first started. The name of Judson Center used to be the Detroit Baptist Home for Children. So we were started 100 years ago by a group of Baptist ministers who had a vision and a mission to do something for orphanage boys and girls. So we are proud of that. We are an accredited organization through COA, the Council on Accreditation, and we work very hard to do the work that we are doing. And I won't go through the next couple of slides, and is somebody working? Okay, our mission, I won't go through it. We're like businesses. You know, you got to have a mission and a vision that's going to drive, you know, where you are and where you want to be, and even help you start thinking about what are the things that we need to do through our values and our goals to get there. So that's our mission statement. And then there is also the staff leadership, if I'm not mistaken, that may be the very next slide. And so, and the three of us are here with you this evening. And my staff, Sue, as the COO, is in charge of a lot of our programs. And here you're going to get to hear from Sarah, who's really responsible for all of the day-to-day operations of the autism programs. One thing, the very next slide. So not only are we an autism provider here in Oakland County, what we're proud of is we have 2 locations, here in Oakland County. One is where we started 100 years ago, right there in Royal Oak, the corner of 13 Mile and Greenfield. We're still right there. We're proud of that location. We plan to be there hopefully another 100 years or more. But autism out of that location, there's one also in Farmington Hills. But in addition to that, we have contracts with some of the other PIHPs in Washtenaw, so we serve the Ann Arbor community, up in Genesee, the Flint community, and then in Macomb County, the Warren location. So we have 5 offices that provide autism services. And, it's amazing as we provide those services, there are waiting lists, because there's still so many children today that's being diagnosed that need and require those clinical treatments. And so now what I want to do is turn it over to Sarah, who's going to tell you more about the services that we provide.
I'm assuming I hit this service. Okay, perfect. Okay, can you hear me okay? Okay. Good evening, everyone. So we want to talk to you a little bit about what our program looks like. So Lenora kind of touched on the locations, that we're in 5 locations across 4 counties. We're serving approximately 185 clients, and of course that continues to grow daily as she touched on the need and the wait list. We accept most commercial insurances, and we do accept Medicaid in every county that we have a location. Our services really, this is something that I'm super proud of for our program, start at 18 months and go through adulthood, right? We know that we don't just snap a finger and turn a certain age and grow out of our autism diagnosis, so we know that need for support and treatment continues through adulthood, and we're really happy to be able to say that we provide that, and I think we're one of the very few who can say that. With our services, we have both center-based, home-based, and then we also have a hybrid. We always want to look right at what's clinically appropriate for the family, as well as are there barriers to accessing treatment and what best decision with the family of where services should be. We do have a very heavy focus on parent training and school collaboration. I like to say we're not really doing our jobs right if our families don't need us less or end up not needing us at all. Our goal is to have that heavy focus on generalizing those skills to the parents and to that school community so that we can actually make a difference in our child's life outside of just the ABA setting. And then in addition, we do provide diagnostics. So we provide commercial diagnostics, as well as we are an autism approved evaluation center with Blue Cross Blue Shield of Michigan. So just to speak specifically to OCHN, this slide covers numbers for our Royal Oak, Bridges, and Farmington locations where we provide Oakland County services. So we've been with Oakland County since 2016, and we have approximately 48 clients that are OCHN that we serve, although I have to say I think since we've just made this PowerPoint that's probably a little bit higher because we are working on growth right now. We have 9 BCBAs, 2 QBHPs, and approximately 60 behavior technicians that are providing that direct service to the children. We are also proud, we're proud of a lot of things. We're proud that in 2005, we were one of the very first autism service providers. And in fact, Judson helped pass legislation to get ABA services covered through legislation with the state of Michigan. And so we just wanted to put a few data points together to show you really the impact that our clinical team and the work that they're doing has on our learners and their families every day. So some data here, we have 93% of learners have made expected progress toward their treatment goals. 91% have made progress in our life skills lab, and I'm going to talk about that a little bit more in the next slide. We also had 100% satisfaction reported by our families that we serve, and that to us is huge because that's extremely important. And then 44% of our learners reduced their time in ABA and increased their time in school. So that's back to my point about trying to integrate into the community rather than just staying with us in ABA. And then what we believe sets us apart. So we actually just talked about the life skills lab. So this is a real life simulated medical, dental, and barber room, and also includes a waiting room. And so it truly looks exactly as it would out in the community. And what we want to be able to do is help decrease that time it takes to build those skills and then generalize them to the real environment. And so our hope is that through use of this room, we're able to do that. And in fact, we just had a dentist come from U of M and provide cleaning services to our children and worked on desensitization. And honestly, I was so impressed with how our clients did. They did such a great job. And so I think that just speaks to just the ability to be able to practice those skills is really unique. We also offer in-house speech and occupational therapy, right? None of us have time to do everything we need to do ever, and that's obviously the case for our families as well. So we want to be able to be a one-stop shop and eliminate that transportation. And then I will finish it up here because I know we don't have a lot of time. Our last bullet point, Lenora really already touched on, but I think that the continuum of support services we can provide to our families is something that we feel is really special. We want to be able to serve the whole person and the whole family, not just provide those ABA services. So to have that outpatient behavioral health, that primary health care, and the respite home, and be able to just work as an agency and collaborate together is just something that we're really proud to be able to do. So thank you so much, and I want to thank Cassandra so much for being here with us, and we just appreciate that she was willing to speak on her experience in treatment. So I will turn it over to you, and thank you again. Thank you, Cassandra.
Hello, good evening. My name is Cassandra Figueroa, and I am here today to speak about our experience with the Jetson Center and my son being autistic. My son is 9 years old, and he was diagnosed when he was 23 months. He has autism. Through growing, he was hitting milestones great, and then kind of they fell off. So he was going to school, and everything was doing good. Around elementary school, that's like when the behavior started to like intensify, and we were having like a lot of regression and a lot of like sensory and things like that. And he wasn't doing really good in school. He wasn't able to like really focus and like do the day-to-day stuff that they do in school. So we had like reduced days. He became like very aggressive, and he just needed a lot of supports that like school wasn't meeting. Like school was for like education, but he just needed more than that. He needed like so much more, and school wasn't doing that. So we were like on a wait list for ABA, and we were on the wait list for a very long time. We were doing like the assessments, and due to like a lot of his aggression and a lot of the centers not having the proper training that they needed, we were getting denied. So it just was really hard. Thankfully, we came across Judson Center that was willing to take, and they had all the training that they needed to help Liam, and that's where he's at today. So we homeschool at home, and then he does ABA full-time. He's been there since January 13th of 2025, and we have seen a lot of improvement. He is nonverbal, but they are working like with PECs, which like are these little picture boards, and he is able to communicate through those, and we're working on those. Every staff in the Judson Center is amazing. Like I go in for training, and they're just always hands-on. We're also working into starting speech therapy in base, like while he's at the center, and that's very huge for us because we've just been waiting so long for that. I'm just very happy that we finally found a center that's able to take our son and be able to give him all the resources that he needs, and yeah, that was it. Yeah.
Thank you.
Thank you all so very much, and I hope you had a chance to see that all of the hard work that goes into providing the services, and especially when you get to hear from a parent. And it makes me so proud to hear all of the great compliments that was given about the staff. You know, this is a program that you can imagine is extremely stressful when you're dealing with children, especially we have young children coming that are nonverbal, and to be able to work with them and to get them eventually where they are able to talk means a whole lot. So we really, once again, thank you so much for this opportunity.
Thank you very much. We appreciate you coming out tonight. I'll ask the board if anyone has any questions or comments for our guests. Go ahead.
Thank you for your presentation. I wish there were 10 more Judson centers in the state. But do you do any training for surrounding communities or professionals?
You want to talk? they're out there all the time, so.
Yes, yeah, we really try to offer trainings. We have even some schools that will approach us that we don't necessarily have consumers with, but absolutely will provide training. We've also worked with even law enforcement and the fire department to try to just make sure that there's safety and awareness when it comes to autism. We've done some training and presentations at the Beaumont hospitals to the doctors and nurses to try to spread some awareness, help promote that appropriate communication and things like that. So if you do know of anybody that's interested or might benefit from it or need it, please don't hesitate to reach out, and we're happy to help.
Yeah, thank you for that. Years ago, my own experience, although Children's Hospital was the one who diagnosed my son, but we have to go to U of M for services or to even develop an IEP for him. So thank you. Thank you for the great work that you are doing.
Thank you so much. We appreciate it.
Anyone else?
I just would like to compliment the Judson Center for what you're doing, and for you has been, I think, recently taking charge of the Judson Center and the outreach that you've done, reaching out to community organizations and what have you. It's really been a blessing to the community, because there are a lot of persons within the African American community who were not aware of the services that you offer and the opportunities that were made available to them. So I want to thank the Judson Center for reaching out to the community, to the residents there. I know you've been there a long time, but the Judson Center has been there a long time. But, you know, the impact that you now have, the name that you have, really shows us that you care for this, and I want to call it epidemic, but just knowing you're there has been a blessing and a benefit to the total community. So thank you very much.
Thank you. Thank you so very much. Thank you.
You may not know this, but everyone on this board either has children who have used services in in Oakland County, or serve individuals in the county, or they themselves have used services. So a lot of symmetry with what you're saying and some of the experience that we've had. For myself, I've had a very unique experience with the Judson Center 30 years ago when I was involved in public service in Royal Oak for 14 years. Judson Center was always someone we tried to support. We couldn't do it monetarily, but through a lot of other ways of support. At that time, your director was Monty.
Yes.
Okay. Now, Monty was one of those rare people who took your time, talent, or treasure, and you felt good about it. So
Absolutely.
He could talk anybody into anything, and I was I was one of them. But he did it with a smile, and you always knew that your efforts in support of Judson were going to result in good things. As a parent, my son hasn't used services at Judson, but a lot of his friends have, and other families we know, and nothing but compliments. You've really been a beacon of hope for so many people. We've been blessed, not only in Oakland County, but in Royal Oak, to have you there. I hope you do have another 100 years, and I'm just very pleased, and I think the whole board is, with all the efforts that you've made and growing, which is important, because we do need services provided in all the communities that you've mentioned, whether in Oakland County or other counties. So thank you very much.
Thank you so much. And just to let you know, Monty is still doing very well. When we had our 100-year celebration, we acknowledged him this past November. Okay. He's still that same man. And if you met him, I'm sure he said, "You are a great man." He's known for saying that.
He was irrepressible, and someone that an organization like the Judson Center needs, because you do need that kind of leadership to inspire other people.
Absolutely.
And Cassandra, I'm so pleased that your son has been able to do so much better in a short period of time, and I think it shows the dedication and attention from the staff. Because I know as a parent, when we can see the day-to-day changes. I mean, my son's 40, and others here have children the same age or slightly younger. You know, when you're close to the situation, you can see people every day progress, even if, like with my son, is at a group home now. But the point is, you can see change when somebody cares and somebody impacts their lives positively. So thank you for sharing your story. Okay, good. All right, thank you. And we're going to give you a little applause.
Oh, thank you. Thank you so much. Thank you.
Thank you so much. All right, we'll move on with the rest of our agenda. Next is the consent agenda, which is a number of board meeting minutes as well as receive and file on our March finance report, our 6-month annual plan update, and our compliance report. I want to assure those watching in the public that all of those key reports were covered in detail last month at the Committee of the Whole. So at this time, I'll entertain a motion on the consent agenda board approvals.
So moved.
Motion in support. I think this is just a voice vote. All those in favor say aye.
Aye.
All those opposed, the motion carries. That now brings us to other business. We have 2 items of other business that I'll cover. First, Dana Lazenby, our CEO, did submit her mid-year report. As has been our tradition or practice in the past, we have the opportunity to have a session with her. Is that something the board would like to do, a mid-year sit down with Dana? Okay. All right. Is that all right? Well then, Trish and Sheila, if you could communicate that, and then what we'll do is maybe we can find a time either before or after an existing meeting is typically what we've done. And okay. Okay. We'll figure it out. We'll have a chat and get a time where we have enough time to sit down and chat. Thank you. And then that our CEO review process starts next month. Anyways, so we'll get a schedule out to everybody on that. Next, we discussed in the executive committee the need for a SUD policy liaison appointment because we haven't had anybody at those meetings recently. So Yvette has stepped forward. So if somebody wants to, and we appreciate that, thank you. If anybody wants to make a motion and support that, we'd all be appreciative.
I'll motion.
All right.
Second.
Support? Yvette, this is your last chance to back out. No, I'm only kidding. Thank you for stepping forward on this. We appreciate it.
And also, the next meeting's in July.
Right.
And if for any reason you can't make it, let us know, because someone's going to go, because otherwise they're going to feel abandoned.
No, I'll make it.
Okay, good. Thank you very much. All right, we have motion and support for Yvette as the SUD policy liaison. All those in favor say aye.
Aye.
All those opposed, the motion carries. Next, we have board reports on our Recipient Rights Advisory Committee. Dr. Hans, do you have any?
It's actually me. No, it's Dr. Oh.
What's that?
Yeah. It's
I'm
reflected
sorry.
wrong.
You know, you're
Yeah,
right.
on the
Uh-oh. Mistake on the,
agenda.
I apologize for that. Go right ahead.
Okay. So our last Recipients' Rights meeting was held on May 1st. We welcomed 2 new members who were approved by the board. We provided appreciation to Lois Schulman, who was ending her 2nd term after serving for 6 years. The committee reviewed and provided feedback on the Rights Picture Handbook. And then the CEO, Dana Lazenby, spent quite a bit of time responding to the concerns that were brought up the previous month. So that is it for that meeting. Very productive meeting. Sounds short, but we spent a lot of time on the picture handbook and with Dana addressing concerns. Thank you.
All right, thank you. The Citizens Advisory Committee, Christina, what do you have to tell us?
Our most recent CAC meeting was held on April 16th online. We had a presentation to learn about the self-directed services in our network, and then we also had a second presentation about a crisis line that is specifically for frontline workers. So that crisis line is called Frontline Strong, and it's managed by Common Ground. Our next meeting is tomorrow morning, May 21st at 9:30 a.m.
Okay.
Thank you.
Thank you. All right. Next is our second opportunity for public comment. Is there anyone online who wishes to speak?
If you are online and wish to speak for public comment, please raise your hand at this time.
Thank you. Is there anyone in the audience who wishes to address the board? There being no one, we'll close public comment. The director's report, Dana is not here this evening, but she has submitted her written director's report, so we'll leave it at that unless, Trish, there's anything you want to emphasize? Okay. All right. And that gets us to the end of our agenda, except for board member comments. We did a lot of work last week at the meeting, so it paid off, and we had a brief meeting this evening for a change. It doesn't happen very often. So I'll start, Dr. Giles, with you on any board comments.
No comment. Thank you.
No comments from me either. Thank you.
Well, I want to thank the board for the work that they do, and certainly was an active session at our last meeting, so that's great. But also, again, one more time, just want to thank the Judson Center for what they do in the presentation that they gave us today. It is no secret autism is in the air. Many of us are dealing with it, but I want to thank them for not only the presentation, but the services that they offer. Thank this board for the work that they do. Thank you.
I want to thank the board for the opportunity to go to the self-determination conference. I went to the conference last week, and it was a really good conference. I'm glad I went. One of the things that stood out in my mind is people with intellectual and developmental disabilities that had the self-directed lives are very strong in their passion, and it made me think. One of the reasons why I wanted to go to this conference is because I want to see more people with mental illness taking advantage of the self-directed life and the freedom that that the people shared was just awesome. We had one of the presentations, we had one of our Oakland County peers, mentors, Amy, presented, and she did an excellent job. And I really, really enjoyed the conference. And I'd like to look more into it for to see what we can do to get more people involved in self-determination.
Well, thank you for representing us at the conference and sharing those thoughts. That's excellent. Thank you. Adam?
There we go, finally. As always, I'd just like to thank all the staff who put the agenda together and put the packets together and everything. But overall, I'd just like to, again, thank the Judson Center for the presentation. Specifically, it is always so positively affecting to hear comments from either individuals or families of individuals served about the positive impact that our providers, through their services, help those individuals live either more independent lives and certainly the lives they want. So again, thank you very much for the personal comments on behalf of families tonight, and have a good night, everyone.
I would like to comment on the Judson Center's presentation. It was great to hear about the one-stop shopping, because as a parent of a child with intellectual disabilities and the autism spectrum, finding barber services and dental services was a nightmare, and to hear that those services are offered as part of the services on site, that just warms my heart that parents don't have to go through all the trial and errors of finding someone who does not understand that population. So that was really great to hear. And I hope they make it another 100 years.
No comment.
I just want to make a quick technical correction to a comment I made at the committee of the whole last week. I mentioned that my concern that the Medicaid application does not have an asset test. That is true of the healthcare application DCH 1446. But I will note that the general Medicaid application, MDHHS 1171, the 1171 form, which is the more general form, which includes applications for food assistance and other programs, does have questions on it that involve assets. And so I'm not a full expert on this, but in talking to people, would suggest that that's the application that we should encourage people to fill out as opposed to the 1446 form, because that asks for assets right up front and families know to do that. And as we know, most of our programs do have an asset test. And so we want families to be submitting that asset information up front. So thanks for indulging me on that, but I want to clarify my comment from the committee of the whole last week. I want to thank Joy. I've been sitting in many meetings here, and I think that's the first substantive public comment that I've heard, and I know I, for one, as a board member, don't want to live in an echo chamber, and so I appreciate her comments tonight. And I am almost done with my 20-plus hours of new board member training, and I just really want to commend Jean and Trish on it, the DOCEBA system and so forth. It's a really great system, and I hope we continue to utilize that system. When people ask, what value does OCHN add to the community? I think we need to be looking for things like that, because that's certainly something where we can really offer a community in that education system and what it provides. It's a really neat system. So thank you for making it available to me. Thank you.
No comment.
First, I want to thank all the board members for their attendance this evening and all the members of the staff who are here also. This weekend, many of us will have the opportunity to have a barbecue, to have time up north, to have time with family and friends. And I hope we all take a moment at some point during that weekend to remember those who have given their lives so we could enjoy those pleasures and also the freedoms that we have. It's Memorial Weekend. I think there isn't anyone that hasn't been touched by somebody in their family, maybe in the past service in our military forces. So as a result, I'd ask everyone to, and on behalf of the board, I know that's something every member treasures, is the service that has been given. And even though Memorial Day is about those who have passed in service to their country, I think we also want to think about the veterans that are living today and those that we serve with OCHN. So we have a lot to be grateful for that service. And so as a result, if we can all take a moment over the weekend as we enjoy ourselves, and rightfully so, it's a national holiday, that we'll take a moment to pause and to remember. So thank you very much. At this time, we'll close the meeting, and we are adjourned.